So I think it's a very interesting time for patients with non-Hodgkin's lymphoma because we're finally seeing the potential for the development of some new and innovative therapies. So traditionally, we've had a lot of ground that we've been able to accomplish with standard chemotherapy, particularly with the addition of rituximab-based combinations, and we know that stem cell transplants clearly have a role. But over the next couple of years, I think we're going to see a lot of exciting new developments. And so, firstly, the idea of immunotherapy using things like checkpoint inhibitors, so the PD-1 antibodies like nivolumab and pembrolizumab that have a lot of activity in Hodgkin's lymphoma. We'll need to see how those drugs perform in non-Hodgkin's lymphoma, and they will probably have a role. In terms of other antibodies, there are, again, another class of antibody called a BiTE. So these are bispecific T-cell engaging antibodies. So they actually have two parts to them, one that can engage the tumor, or one that can attach the normal T cells. So this is the effector, the soldier of your immune system, can bring the two together to the same party and then have the soldier meet the enemy. And that seems to be a very winning strategy in ALL. And so we're kind of seeing now with early days how that strategy will pay out in aggressive histology non-Hodgkin's lymphoma. So that'll be another interesting sort of therapy that we'll see available in the next little while. Antibody drug conjugates, so what we call ADCs. So these are antibodies that have chemotherapy attached to them. So it's basically a smart bomb. It's a way to deliver a payload targeted to the cancer cell. So again, we've seen this proven in Hodgkin's lymphoma with the treatment brentuximab, which is now a standard therapy in the relapse setting and being evaluated in the frontline setting in combination with AVD. So again, these are treatments that look like they could be potentially quite promising in non-Hodgkin's lymphoma, but we'll just have to see how these things play out in the next little while. And I think lastly, there's a lot of excitement with two other broad classes. So there are signaling pathway inhibitors that are looking at all sorts of novel pathways. And then finally, there are these things called CAR T cells. And so again, this is an immunologic cellular treatment that takes an engineered cell product and infuses it back into the patient. So it's their own cells that have been modified. And they've seen, again, some very exciting results in ALL and in CLL. And we've seen some very early exciting results in lymphoma as well. And so from my standpoint as a clinician treating lymphoma, it's great to have a lot of new potential tools in the toolbox, and it's great to see some very exciting and innovative clinical trials being done as great opportunities for patients when they need new options.